Okay. Who would like to start? I think in the list there are at least 6 candidates who stated that
I
they the stations.
I can start, doctor.
And by the way, there are two stations which are free to go, and I think they are very important: alcohol dependence and heroin dependence, particularly the alcohol dependence. So if anyone wants to take them, even if she or he already had booked the station, no problem. So please, if you want to do them, just read them until we finish. So, Doctor, who would like to start? So again,
I
Doctor
can start, doctor.
Doctor Summer,
Summer.
is it? Yes. Okay. So,
Yes.
what is your station, Doctor?
Grieve reaction.
Yeah. You have 2 minutes. Just read the station, please. Don't forget to read the role plays notes to understand the dialogue and what is going to happen and what the role play is going to say. This will make you more comfortable in what you are going to do in the station.
Okay, I'm ready, doctor.
Okay, just give a few seconds for the candidates.
Okay.
Okay, we'll start now. Say that my name is Mrs. White. One, two, three, go.
Hello, Mrs. White. I'm Dr. Summer from the Mental Health Unit. So I understand from the note that you have been referred by your GP because he is concerned about you. Is it correct?
Yes, yes, it's right.
Yeah, I'm really sorry for your unfortunate loss, Mrs. White, and I'm here to help you understand that's a sensitive issue and it's a painful moment to remember. But I need to ask you a few questions to make sure I have all the information to help you with. Is it okay?
Okay, okay.
So, Mrs. White, can you tell me what's bothering you in this moment? How do you feel?
I don't feel that I am motivated to do anything. Most of the time, I feel low. Sometimes I am
Oh,
crying. Just my eyes are crying, and I don't know why. And I
yeah.
lost maybe 1 kilogram in the past months. My family said that I must
Oh,
talk with the GP, so he said that I must talk with you.
yeah, it seems so difficult, Mrs. White.
Yeah.
Really sorry for that. So, Mrs. White understands that your husband, what his name is?
Is Mr. White?
Mr. White, okay, I understand that he passed 2 months ago. Is it
Yeah.
correct? Were
Yes.
you
Yes.
able to attend his funeral?
Yeah. Yeah. I was able to attend this funeral. I was trying to hold myself in the funeral.
Yeah.
Yeah.
And was this expected or sudden?
No, actually, it was not sudden. It was a heart attack. I know that he had a
Mm,
heart problem, but I no one expected that it would be a heart attack, which can be fatal.
yeah, I see. And how did you feel after that? How did you react with this?
Well, in the beginning, I felt as if I was, well, not real or just a state of, if it is just a movie. I
Mm,
didn't know what's going on, just going with the flow with the funeral and meeting the people and sitting with them
oh, I
and with
see.
them in the beginning, but later on, a lot of emotions stayed up.
Yeah, I understand. And about his belongings and so, Mrs. White, have you tried to keep them or you give them to anyone?
No, no, because I know that he would have preferred to give them to charity. So as soon as
Yeah,
I realized
yeah.
that he will not come back, I just deleted everything. And this is also was the advice of the family.
Okay. And through this couple of months, Mrs. White, have you felt that you are getting better or worse?
Well, I feel that I'm not. My family say that I'm not getting better, and I lost one
Mm,
kilogram, and I don't want know what to say.
yeah. Okay, Mrs. White. So I know that some people they feel like angry after such advice. Have you felt like you're angry about yourself or others?
Well, yes. In the beginning, I felt angry
Mm,
because I didn't expect this fate. We used to do a lot of charity, go to the church,
mm,
and we were happy. We were good.
mm.
Why should this
Okay.
be our fate? Um,
And have you felt like guilty or so?
yes, sometimes I felt if I was more keen to help him to go to the doctors and pay attention to his medications because he was not very keen to take his
Mm,
medications and he drank from time to time and I was
okay.
so lenient about this. Maybe it was my mistake, I don't know.
Yeah, I see. And sometimes people they feel like bargaining, like if God made a miracle, if He'd come back, things like that. Have you ever felt like this?
Yes, if I only if what if I just stopped him from smoking and drinking? If I
Mm,
did what God wants me to do, maybe I will feel better. So, but this will never change
yeah,
anything.
yeah, I see. And you mentioned that your mood is not so good and you have lost 1 kilogram, is it correct?
Yes.
And yeah, about enjoyment, your activities or hobbies, do you still enjoy them?
No, because everything was
No.
in, well, we were doing everything together. So now it's difficult to be alone.
Mm, about sleep, do you sleep well?
No,
No. So, Mrs. White, do you have any underlying medical disorders?
no,
Taking any medications?
no.
Mrs. White, sometimes when people lose their beloved ones, they may experience unusual things like hearing their voices when they are not around. Has this ever
No,
happened with you?
no.
Okay, or seeing him.
No.
Okay. And do you have anyone to support you through this?
Yes, I have my family and I also have my son.
Oh, I see.
1 minute
Any,
remaining.
mm, okay, that's good. Okay, and about any stressors in your life, like financial stressors?
No finances. Everything was okay when he
No,
left and everything.
no. Okay. How did this loss affected your life, Mrs. White?
Well, I'm not able to do anything because I used to do everything with him for more than 40
Mm,
years, and I'm just
mm,
living my day without him.
okay, and how do you cope? Sometimes people use alcohol,
No,
recreational drugs.
no,
Have you ever had these dark thoughts about ending your life or harming
no,
yourself?
no.
Thank you for talking to me, Mrs. White. I think you have been through all the stages of normal grief. I'll give you some leaflets about that, and I'm looking forward to see you again.
Excellent, excellent, mashallah. Excellent from my perspective and according to the information which you should have delivered and the organization and the empathy. Excellent, mashallah. Excellent.
Thank you, Doctor.
So let's see, according to my notes, how this station. I didn't have any feedback actually. It was very good. All what I want to just to remind everyone in this group that this particular station, candidates might lose it because they don't show empathy. They might go very technical about everything, and everything technically is right, scientifically is correct, but no rapport, no empathy with a lady who has lost her husband, and they don't pass. And don't forget that out of the 12 points of your assessment, 6 of them are related to the communication. Okay, so let's see. Your introduction was very good. You did mention that it is a sensitive issue and you showed condolences and empathy. Excellent. And then you are very keen to start from where she would like to start. Maybe she can start by the symptoms of grief or start with the symptoms of depression. You must be ready to assess which of which. If she talked about depression, just go with the depression regarding the sense of worthlessness and guilt, onset, course, and duration, and everything regarding this particular syndrome. And don't think that this is a waste of time because it is part of the grief reaction. She is already presenting with depression. She is referred to you with depressive symptoms. So you must show that you understand your priorities. Okay, and then definitely you should go through the symptoms of the grief, which you did very well and in a very organized way. And then the comorbidity very well, particularly the social. You ask if there is anyone around her to support her. Excellent. And the impact and coping and risk. You're keen to make sure that she doesn't have any of these dark thoughts of harming herself or joining her husband, or just or life is not worth living. Everything you did was correct. Maybe you missed past history and family history, but I don't think that after your good performance, this would have been a very good something which is serious to miss. And finally, delivering the diagnosis, excellent. So let's see, according to the mark sheet, and the first thing which I would like all of you to pay attention to is your communication skills. This is a station in which there is a considerable amount of communication required in it. Okay, so maybe you will score every point in this history taking task, but communication skills might make you not pass because you will not hit the passing score, passing curve. You will only score 50% because you were good technically, but in the communication part, you were not good. Everything in your history taking communication was good from my perspective. Excellent. You did identify the issues and priorities. You did recognize the significance of aspects of history. She has depression, and also there's a history of the death of her husband. You did explore the symptoms in details. Adequate risk assessment. You asked me about the risk taking alcohol, dark thoughts. Very good. The notes is formulated according to the mark sheet. Um, does not pay sufficient attention to the patient health review. I felt that you were keen to understand what I'm feeling and sharing with me what I'm feeling and discussing it with me. Psychological and social information, as I said, it was very good from you to ask about any support around you. And this is one of the common mistakes in this station, that they can just forget to ask about the social information. So most probably they will lose point number 6. And definitely you asked me about the psychological symptoms of depression and any associated psychoses. So I think you also scored point number 6. And your communication was very good. It was organized, not formalic. Your attitude was good. You had good listening skills. Your questioning style and use of language was good. Everything was good, excellent. I'm not here to say who would pass or fail, but just helping you to understand how you are assessed. Please always use this mark sheet while you are preparing for the COSC. Don't leave the assessment for your personal judgment, even if you are experienced. It is a game. The COSC is a game, and this mark sheet is simply the rules of the game. Thank you so much, Dr. Samar, mashallah. So who would like to go next?
I would like to go next, doctor.
Okay, Dr. Ayara, what is your station?
OCD.
Okay.
Jordan.
Okay. So you are talking to Mrs. Let's say that my name is Mrs. White, and you are going to assess my condition. Okay.
Mrs. White?
Mrs. White, yes. And don't forget to read also the role player's notes. It will help you to understand
Yes.
how the scenario goes on. Okay. So I'll give you 2 minutes, bearing in mind
Yes,
that
please.
you have already read this station, but also to refresh your memory and also to give chance for the candidates to read the notes.
Okay.
Okay. Ready?
Yes.
Okay. 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 Please start your station.
Hello, Mrs. White. My name is Dr. Yara Ihab. I am one of the mental health team doctors working here. I
Hello.
understand that you are here to answer some questions you have about your son Jordan. Am I right?
Yes, yes. I'm very worried about him, and they say that all my fears are not real, and I don't know what to do actually.
Oh, I'm so sorry that you are feeling like this, and I'm here to assure you and answer all your questions and concerns. First of all, let me ask you, Jordan is 6 weeks old now, am I right?
Aywa? Yes, yes. Yeah.
Okay. And what do you feel about having a child?
Well, I'm very happy that I had this child. I was waiting
Oh,
for him. I didn't have children for 5 years.
oh, congratulations then.
Yes.
So, could you tell me, please, what concerns you about Jordan?
I keep have this feeling that there is a lot of corona and H1N1. I don't know this H1N1 which is harmful, and I must sterilize everything around the baby. And now I have this
Mhm.
strong idea that I must also sterilize the baby himself because I don't know,
Oh,
maybe he will also had this harmful
oh,
thing
I
on
see.
him body. Yeah.
That sounds very distressful.
Yes,
So,
yes.
so how many times do you wash his things or sterilize his
Well, well,
things?
well. 8 times at least, and the final one must be with alcohol.
I see. And what if you didn't wash them 8 times?
I feel that I didn't wash them enough. Well, I have a strong urge to wash them more than 8 times, but this is the least amount of time of washing which I can feel that it's okay that this thing is already sterilized.
Oh, I see. So, these thoughts about washing uh, uh, these things of Jordans, or these are distressing thoughts for you?
Yes, yes, very distressing. I'm not happy with them, but I feel that this is my role as mother to protect my son.
Yes, you seem that you are very, very protective mother. And are these thoughts your own thoughts?
Yes, 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 exactly.
Oh, I see. Did you try to resist them ever?
I try, but I cannot. I
Oh,
can't. I feel that they just dominate my mind.
mm-hmm, mm-hmm. Do these thoughts make any sense to you?
I know that they're totally senseless. I
Mm-hmm.
have some idea about medical issues, and I know that what I'm doing is totally senseless. But this is what happens.
But what medical issues that you mentioned?
I'm interested in reading about medicine and how to make
Oh,
everything healthy. I like to live a healthy life, and I
yes.
understand that what I'm doing is nonsense. This is not how to
Oh,
protect
I
anyone
see.
from anything, but this is what's going on.
Mm-hmm. And you told me before that these are intrusive and urging thoughts. Am I right?
Yeah, they just come to me, and I cannot resist
Mm-hmm.
them or resist them.
Mm. I want to ask you if you have any other thoughts, like thoughts of contamination, maybe.
Well, I have this thought that it might be everything is contaminated by this H1
Mm-hmm.
N1.
What about thoughts of infection, that you will be
Yeah,
infected or Jordan
yes,
will be
yes,
infected?
yes. I have these thoughts that because of the contamination, there will be infections.
Mm-hmm. And what about if you have any thoughts of aggression,
No, no,
any religious thoughts?
no, no.
So you have only these thoughts of contamination and getting infected. Am I right?
Yes, yes, yes,
I see, I see. So you told me before that when you do have these thoughts, you keep wash the stuff for Jordans maybe 8 times,
yes,
with the last time with alcohol.
yeah,
And this is the regular pattern then you
yeah,
that you make it every time. Am I
yeah,
right?
yeah, yeah.
Okay. Do you have any repetitive behaviors rather than this, like checking or something?
No,
Any rituals?
no, no.
Okay, okay, that's fine. So, I want to ask you about your mood. How is your mood been through all of this?
Well, I feel frustrated. I feel so depressed sometimes and angry because I cannot get rid of all these bad thoughts.
Mm-hmm. What about your sleep?
Well, I sometimes I sleep. I sleep well, but not most of the time. I can't say that my sleep is the best thing.
Because you are a new mom, or there is something
Yes,
else
I
that
need to
bothers
take
you?
care of the baby. I need to do a
Mm-hmm.
lot of washing and sterilization.
That's fine. That's fine. And I want to ask
1 minute
you,
remaining.
are you the type of person who gets easily worried about
Yes.
normal things about all the day?
Yeah, 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 yeah.
Mm,
This is me.
okay. So, about all you are going through, how is life changed through all of this?
I cannot do anything. As I said, I'm totally incorporated and
Mm,
by this checking and by this sterilization.
mhm. And are you able to take care of yourself and taking care of Jordan?
No, no, no. I'm not able
And
to take care of him.
do you have anyone to help you with this?
My mother, but she's not always available.
Oh, okay. Do you have any concerns about your safety about or about Jordan's
I'm
safety?
afraid that I cannot take care of my baby and I might hurt him by this sterilization.
I see. And this is the first time you saw a psychiatrist, or did you see a psychiatrist before?
No, but I used to take some medication time. How
Ah,
do you feel
okay.
about what you did?
I have a problem in history stations that I don't cover all the items of them.
Because it is
Uh,
matter of language, you can say the what you want to say in fewer sentences, and
yes.
if you waste time in every sentence you're going to say, let's say that
Mm-hmm.
in every sentence you used 1 or 2 more seconds. At the end of the station,
Okay.
you find that you've wasted not less than 30 to 40 seconds, maybe 1 minute just in the way you are talking. So this
Mm-hmm.
is why you lose time, and this is why you are not able to continue the station. But
Mm-hmm.
all in all, it was good. But in introduction, you don't say that I know that you are here to answer some questions. No, you just say that I'm gathered from the notes that you wanted to talk with one of our team members, and I'm here to help you and show empathy in your in the beginning of the station.
Mm-hmm.
Dear doctors, I hope that you give us some feedback. Time management, active listening. Dr. Summer, yes, she gave you this nice feedback. I hope that everyone helps everyone by giving feedback in the chat section. Yes, exactly, time management. Let's see, according to the so as you can see, you should show empathy, and this schedule will help you with some sentences which you can use to show empathy. And you don't need to make it a psychotherapy session and showing empathy all along the station. Just show
Mm-hmm.
empathy in the beginning, particularly in the beginning, maybe once or twice, then on with 1 or 2 sentences. But in the very first beginning, you should have showed empathy. And I felt that you're not very empathetic in the very first beginning. Complain. Now, whenever you want to assess any patient and take from him a history in order to arrive to a diagnosis, as me as a consultant, the first thing I want to know the onset, the course, the duration, and what happened. How was she doing before the onset? I want to know exactly when did
Mm.
the story start.
Yes, yes.
You didn't ask this, and this is a very important point in the history taking. So, as someone who is proposing himself to be a member of the Royal College, and he is after 7 minutes, he doesn't know when did this story start and
Mm.
how the patient was doing before that. Um, this is a big mistake. Okay,
Mm-hmm.
so pay attention. If you want to take history from even in your clinic, and you want to take a history in order to reach a diagnosis, there is a particular sequence. Let's start with the complaint. You want to know exactly how to do the complaint. You must
Mm.
ask about the current situation, and then you want to know exactly the onset. When did it start? Okay, and the course, is it increasing? Is it decreasing? What makes it increase? What makes it decrease? And how was she doing before the onset? Okay, this is how you assess the complaint, and this is how you give a good impression that you are a professional doctor in taking the complaint. We don't just go to the symptomatology. We want to know exactly when did the story start, how everything is going on, what is the current situation of the patient, and how was the patient doing before the onset. Why is that? Because before the onset is a place in which the Royal College usually puts a lot of tricks. So before the
Okay.
onset, because they want to know who are the candidates who are keen to understand what are the perpetuating and what are the precipitating factors. And you will never know anything about these two factors except asking about how was the patient doing before the onset. Okay?
Mm-hmm.
And the symptoms of the syndrome, you ask them very good. And there is a lot of symptoms, and there is a particular acronym which will help you, DROSI, Cigar and Crow. You can go through them. And there is a YouTube channel to see the obsessions. You must make sure that this D stands for distressing. If the patient resists them, or and if it is his own ideas, it doesn't make sense, intrusive. So this is Drusi, then the compulsion, cigar, and then Crow. Now the Crow compulsions are Crow. Obsessions are cigar. Okay, the types of obsessions are cigar, and the type of compulsions are Crow. And this is how you differentiate between the obsessions and the delusions. And actually, because a lot of the candidates just did not know how to differentiate, as far as I remember, in the task, they stated clearly differentiate between obsessions and delusions. So how to differentiate is by making sure that the patient is establishing this drusi, distressing resistance, own thoughts, senseless and intrusive thoughts. Cigar and crow are the types of obsessions and compulsions, respectively. So very important to ask about these 5 points, which I just mentioned, and the acronym is drusi. Comorbidity. Very good that you ask about the anxiety. You missed the psychosis, which is common. Okay. You're very good that you asked me about my social circumstances. Very good that you asked me about the how did it affect my life. Did you ask me about concerns about concerns of safety? Very good. You were about to finish. I think you didn't need more than 10 seconds. And when you only need 10 seconds, this means that you're wasting time, not because you are disorganized, but because of your language, the way you are talking. So you need to be more fluent. Okay. So let's see, according to the mark sheet. So we did identify the issues and the priorities. You say, well, yes, significance of aspects of history, because the complaint is a very important aspect of the history. I don't think that this point might be scored for. You did number 3, enough details in the symptoms here. Skills and risk, you asked me about the safety of me and the baby, very good. You did pay attention to what I'm saying and paid attention to my health and view. Psychological and social information, you asked me around anyone around you to support, very good. Maybe the psychological, because you did not ask me about important psychological comorbidities like psychosis, this point might not be scored for you. It is not uncommon that they can. And number 2, if you want to screen for depression, you ask me about the vegetative symptoms. So we don't do this in order to assess for depression. We start by the main symptoms, like how would you rate your mood, any sense of guilt, of worthlessness, any energy, do you feel that you have the energy to do the routine things? So these are the main questions. Not the sleep and appetite, okay? Because you did not ask about the complaint and you did not finish in time, so 0.7 might not be scored for you. Also, the issue of language might not help you to score the last 2 points, which I know that the candidates feel that they are not fair and they make the exam biased towards those who are native English, but this is how the task is done. The last 2 points are related to the language, the questioning style, and the use of language. So these 2 points might not be scored for you. It's not a pass or fail, just to help you to know what are the areas which you are good at and what are the areas which you need to work hard on. Okay. Thank you so much, Dr. Young. Thank you so much. Very good. See, you did a lot of effort, but with practice, you will cover all the points which I've just mentioned. So who would like to go next?
I would like to go.
I would like. fine.
Okay. I would like to go next.
Okay, Dr. Mariam. Well, Dr. Salman is giving you a very nice feedback. I hope that Dr. Yara pays attention to. Yes, very nice feedback. Okay, so Dr. Mariam, what is your station, doctor?
Doctor, it's generalized anxiety disorder.
Okay, generalized anxiety disorder. Well, regarding the generalized anxiety disorder, I understand that all of you are anxious. You're not very happy to put yourself on the cam, but this is anxiety. In the exam, you will be anxious. You need to have some sort of immunization against this anxiety. So, yes, I understand. I respect your request not to be uh, recorded visually, but I hope that this will not dominate your performance. Okay, don't make your anxiety dominate you. There must be another setting in which you're able to show yourself and your performance in front of everyone, because this will be very close to the exam. Okay, no hiding behind black screens. Okay, so good that you mentioned that you're going to do this particular station. So pay attention to the details of this station. Okay. But this is not only for you, Dr. Mariam. I mean, for all those who prefer not to make just to make the screen black. This is not the best situation. Okay, so
yeah. Thank you so much. So his name is Mr. X.
okay, yes, let's say that my name is Robin.
Sorry, doctor.
My name is Robin. Robin.
Robin. Okay.
Robin. Okay, I'm ready whenever you are ready. Ready?
Yes, doctor. Doctor, can you hear me clearly?
Yes, I can hear it clearly. Yes.
Okay. So I'm ready.
1, 2, 3, go.
Hello, Mr. Robin. I'm Dr. Mariam from the mental health team.
Hello, doctor.
Notes that you have. I gathered from the notes that you have some anxiety issues, and you were prescribed some medications. Can you tell me more about that?
Yes. I have, these tense of feeling tense. I talked with my GP. He said that I must talk with you. I have a lot of things which run on my mind, and this anxiety is not make me happy.
So I totally understand. It's very painful to you, and it seems we have a lot of things that we need to tackle together, like feeling tense, being excessively worried about a lot of things.
Okay.
Can you tell me when it all started?
Well, I think it started about 10 years ago.
So for these 10 years, anything happened before these 10 years?
Well, before that, I was, everything is okay, but it started with my new job. I used to be in dealing with the customers who always complain, and sometimes the situation might escalate. And this is
Mm,
was how it was going on with this new job. I felt that I am more tense most of the time.
mm, mm. So dealing with these customers makes you very anxious and escalates the feeling of being tense.
Yeah.
And what comes in your mind when you think that you are worried?
Well, I'm on the edge, everything puts me on the edge. Nothing
Mhm,
comes on my mind. Everything, is catastrophic. Everything I feel is going to end in a bad way. This is what happens.
mhm. And do you ever thought that dealing with the customers will make you feel more inferior, or they will judge you?
No, no, it's just because, the nature of dealing with the customer's complaint always makes me for not less than 8 to 10 hours sometimes dealing with these stressful situations. So
Mhm.
this is what
I,
happened.
I totally understand. It's very painful to you, and I need to know more. What happens in your body, like a physical symptoms when you feel this anxious?
Yes, yes, I feel, sometimes I feel that my muscles are tense, sometimes I feel trembling and sweating, and for unknown
Mm,
reasons, I feel tired.
yeah. And how this impacted you?
Well, as I said, it makes me on the edge. I have a lot of problems at work now, a lot of problems in the street, a lot of problems in my house. And, I feel
Mm,
bad after being on the edge and losing control.
yeah. Totally understand. It's very hard to lose control and to have these impairments and your like family issues and also work issues. And anything was concerned regarding your safety, any safety concerns?
Well, sometimes because I'm on the edge, I quarreled several times at home, and sometimes my
Mm,
wife, well, now my wife left the house because I'm
mm,
always on the edge.
mm. This is very tough. And during these quarrels, any physical injuries happen to any one of you?
No, 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 no.
Do you have any other quarrels at work?
Yeah, yeah, yeah. I'm quarreling with the customers too much, and my manager said that I cannot continue in my work if I continued like this.
Mm. And anything got escalated till it reaches to the police?
Excuse me?
Any of these quarrels were escalated to reaching to any legal issues?
No, no, no.
Okay, thank you to know that. And I need to know how this affected your mood.
Well, I'm frustrated. I know that I could have, my life should have been better in my house and in my job, but because of this anxiety and being on the edge, I'm
Mm,
I'm tense.
this is very hard. And do you feel sad?
Excuse me?
Do you feel sad?
No, 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 no.
Okay, do you enjoy the things that you usually enjoy in life?
Yes, yes. Well, I feel that when I go running and going out with my friends, I feel better.
Mm, good to know. And what about your appetite?
My appetite is good.
And what about your sleep?
My sleep is good. Sometimes I don't sleep, but all in all, yeah, it's good.
Thank you to know that. And I have such a sensitive question. Like, do you ever thought of harming yourself when you pass
No,
through this?
no,
Thank
no,
you.
no.
And
1 minute remaining.
do you cope with this anxiety by taking any drugs or alcohol?
No.
Thank you. Good to know. And can you tell me more if you have any family history of the same disorder?
Yes, my mother used to be treated from a generalized anxiety disorder.
Mm-hmm. And it's your first time to visit a psychiatrist?
Yes, yes.
Mm-hmm. You were prescribed before citalopram and propranolol. Are you compliant on these medications?
No, I'm not happy with them. They are not improving anything.
Mm. And you didn't take them at all, or any side effects?
No, no, no side effects.
So thank you, Mr. Robin, for talking with me. I think you have an anxiety disorder, and we will need another session to discuss the management in detail.
Okay, Simon, how do you feel about what you did? Please give your friend some feedback. How do you feel about what you did?
I felt like being a little bit disorganized.
Yeah,
Um,
and you were very checklisty. I can feel that you're anxious. You have
mm,
your own information, which I know that they are enough, and the questions which you want to say are enough to help you to pass the station. But you're very
mm,
checklisty. I didn't have, I felt that I am interrogated by no police officer, not by
mm,
a doctor. Okay, so pay attention to the way and the sequence and the rate of the questions and the attitude by which you are asking your questions. Okay,
mm,
you did not ask me
mm,
about any anxiety symptoms, which I don't know why. Any anxiety disorders. So it is not uncommon to, he might have panic
mm,
attacks, social phobia. Okay, very
mm.
important in this station to ask about these questions, about these disorders, more important than the depression. Okay, as I said, I
Okay.
can feel that you are a type of person who is anxious. That's why you don't like to have your cam on. You have the total right to do so, but I'm helping you to understand what are the points which you should pay attention to. If you are just a type of anxious who is anxious like this, you can simply overcome this anxiety by trying to have a performance in the group. No problem if you did all the mistakes now. We are all the candidates are here to understand how to
Mhm,
pass the task, and they are here because they do mistakes. Okay, they are very good why they are here. So definitely they have their own uh, areas which they need to correct. So no problems if anyone did any mistakes, whatever the name or the quality or the quantity, no problem. Okay, so let's
thank
see
you
the
so much.
feedback of um, empathy, structure, and empathy. And he said, I am must be painful too many times. Too many, yeah. Yeah, don't be because you are because you are very formality, just repeating things. As I said, this was not an empathic dialogue. You had this particular set of questions and maybe one or two sentences to show empathy, and you repeated them in a way which did not give the good impression. So let's see according to the mark to this. Okay, so pay attention, doctors. This is your plan when you go and see a history task. You must understand that there must be an introduction which is good with empathetic, and it is a very simple rule. There is a very simple rule for the introduction. You introduce yourself, you address the patient by his name, and explain why this meeting is held. And though this is a very simple rule, many candidates don't do this. They don't address themselves, they don't name the patient by his name, they don't explain why they are talking with the patient, and they don't show empathy while they are introducing themselves and hearing the complaint of the patient. Okay. Number two, the complaint. Very important because as a professional doctors, you must understand how to take history. It starts by the complaint, not by the symptoms. And the complaint is simply the onset, the course, the duration, and how is the patient doing before the onset. So these are the four components of the complaint. Then the symptoms of the syndrome according to the the syndrome which is crystallizing itself in front of you after taking the complaint. And then ask about the comorbidity. And there is a very important rule and which you should all pay attention to in order to have good time management. Once you hear the bell of 6 minutes, immediately start and impact the coping and risk. Ask about the past history and family history. Deliver the diagnosis and terminate. You can hardly do these 3 or 4 points in 1 minute. So this is how you terminate the session. If you did not reach the point number 5, immediately leave whatever you are doing. You can hardly finish these important points and terminate the station professionally in 1 minute. So this is a very important point in the time management, which you should all pay attention to. Okay, your introduction was good. I didn't feel that I think you took the complaint because it was a bit disorganized. I think you took the complaint, didn't you? The current situation, when did it all start? Do you feel it is increasing with time? What makes it increase? What makes it decrease? And how were you doing before that? Okay, so this is how you assess the complaint in the very first beginning. And after assessing the complaint, you will understand that it is a generalized anxiety disorder. And some candidates don't know what to do in order to assess any syndrome. So any psychiatric syndrome or any psychiatric phenomenon, in order to understand it and understand how to ask about it, you can analyze it into feelings, physical symptoms, thinking, and behavior. So these are the 4 domains which you are going to ask about in any psychological phenomenon, even in your private uh, uh, private patient, with your private patients. You can, in your clinic, if someone is coming to you with any vague symptoms and you don't know exactly what's going on, organize the questions in your mind according to the feelings, physical symptoms, thinking, and behavior. So here are the feelings. Do you feel worry? You want to know. So most of the patients, they feel worry most about everyday event. They are just on the edge. Do you feel that you are on the edge most of the time? Ever have the feelings of fear, influence, and control? So these are the set of feelings. I will not go through them, just you can read them. Set of feelings which are commonly associated with the generalized anxiety disorder. Very important to ask about the physical symptoms, because we know that the pathophysiology behind the generalized anxiety disorders is in autonomic hyperarousal. So there are very common, and there must be present some physical symptoms like palpitations, muscle tension, tremors, dry mouth, chest tightness, abdominal discomfort. And unfortunately, do not ask me about these symptoms. If you are professional, you will understand that these are the most important symptoms because they reflect the most important thing in the autonomic generalized anxiety disorder, because they really make the diagnosis valid that there is definitely an autonomic hyperarousal. Okay.
So I asked if he's experiencing any physical symptoms, and he replied
But
that there is sweating.
you must name them. I gave you some symptoms, but you must name. You said just physical symptoms, but you must show the examiner that you know the other symptoms. I did not mention palpitations. I did not mention dry mouth. I said that I have some muscle tension and sweating. I
Okay.
expected from you to ask me about the palpitations, the dry mouth, chest tightness, abdominal discomforts, and hot flushes. Thinking, we are always having these catastrophic thoughts in their mind. Behavior, do you feel that you become easily startled? Their behavior is they have this characteristic behavior that they are easily startled or easily agitated, an overt behavior. Okay, so this is how you ask about the symptoms of the syndrome. I don't think that these set of simple questions are present or organized like this in anywhere else, so you can have screenshots. Okay, please have this screenshot. And again, screenshots of these physical symptoms. Okay. Now, psychologically, you did ask about the depression, but more important in this particular station to ask about the common anxiety disorders like the social phobia or panic attacks or OCD, anything which just show the examiner that you understand that there could be a comorbid anxiety disorder. You ask about the mood, very nice, but it was not enough, as I said. Psychosis, you did not ask about. Very important, doctor, to ask about medical problems. This is an area which the Royal College can put a trick in it. As I said before, and I'm saying now, the real stations are not a copy paste of the notes which you have in your hands. They can make a trick here or there or change something. So very common to have a medical problem with those who are having a generalized anxiety disorder. Social, you did not ask me about. I think, did you ask me about the impact, how am I coping with everything and so on?
Yes, I think I asked
Okay.
how he was impacted, and regarding the coping, I asked if he coped by alcohol or drugs, but I didn't
Very
ask an
important question.
open-ended question.
Yeah, very important to ask about the alcohol because it is a very common coping way in the West that they drink alcohol. It is an anxiolytic, but eventually it ends up with a more devastating problems. Okay, so you'd ask me about family history and then deliver the diagnosis. I'll go through the mark sheet last time just for the sake of time management. So you did identify the issues and priorities, yes. Significance of aspects of history, yes. The enough details of because you missed some important details, symptoms, so point number 3 might not be scored for you. Skills and risk assessment. Did you ask me about thoughts of harming myself and so on? Hello? Okay,
Yes, doctor, I asked about if he
yeah,
had thoughts for
very
him
good.
himself.
Okay. Does not pay sufficient attention to the patient's history. I think you did. The psychological and social, you did ask me about the social information, but I felt that you needed to ask some more information in the psychological area, particularly the associated comorbid psychiatric anxiety disorders. It was a bit disorganized. I felt that was very formalic, you were checklisty, so these 2 points might not be scored for you. The rest of the points are okay regarding the communication. So thank you so much, doctor. Don't be frustrated. Just to help you to understand how you are going to be scored and in order to help you to improve your performance. Okay. So thank you so
Thank you, Dr.
much.
Sam.
Okay, who would like to go next?
I would like to go next. Fejir is my name. I'm trying to change the name. I can't change it. I'm doing the overdose. I think it's overdose station.
Okay. Okay, Dr. Rami. Okay, so let's the heroin,
No, that should be. I think it's overdose. Sorry, I'm trying to open the.
pediatric
My
overdose.
name is Fejiro. Fejri. Yeah, pediatric overdose. Yeah.
Yeah, okay. Okay, so Okay, ready?
Okay, yeah. Let me try.
Okay.
Hello, my name is Dr. Siagoro. I'm one of the
Wait,
psychiatrists here.
just wait. I will start the timer.
Okay.
1, 2, 3.
Okay.
Let's say that my name is Anne. Okay, Anne.
Okay.
1, 2, 3, go.
Okay. Hello, Anne. My name is Dr. Siagoro. I'm one of the psychiatrists here. I've come to speak with you today as I learned you've been having some difficulties recently. Yeah, I'm here to talk
Yes.
to you and see how best to support you. Okay, yeah.
Um,
And
yes, I just I don't want them to hurt me. I don't want them to hurt me. I cannot live with what they want to do.
oh, Anne, who are the them, please?
They.
Yeah, who are they? Those that are trying to hurt you?
Their name is in the paper.
Okay. Okay, yeah, I can see that on my on my notes here. The notes notice that you had a paper and you wrote something that they are coming. So can you tell me about this?
Well, they want to impregnate me, and they are aliens, and I cannot do what they want me to do.
Okay. Uh, for how long have you been feeling this way, Anne?
This was about 1 month ago.
Hmm.
They started to talk with me, and they told me what they want to do.
Hmm. Okay. So these aliens, they were talking to you.
Yes, yes.
Yeah. Did anybody else see them?
No,
Mm-hmm.
only me.
Okay. And did you also see them?
No.
Mm. What were they telling you, Anne?
They said that they want to impregnate me.
Mm. Okay. And apart from that, did they tell you anything else?
What?
Apart from that, did they tell you anything else?
Yeah, they want to do this with everybody on the planet.
Mm. Okay. Yeah, I see it from the notes that you took an overdose. Okay. Were they the ones that told you to take this overdose?
No, I took them because I don't want to have an alien baby.
Mm. How sure are you that these aliens are real?
I'm 100% sure that
Mm.
they want me. They want to impregnate me.
Okay. And do you feel that they are controlling you in any way?
Yes, they might come at any time and impregnate me. I must not do this.
Okay. Did anything happen, Anne, before you started noticing these aliens?
Yeah, I felt that everything is weird around me,
Mm,
and yeah, but everything made sense when I started to hear their voices
mm, okay. And these voices that you hear, okay, do you feel that it's coming from in your head or outside your head?
inside my head.
Outside your head. And how many voices are there?
Several aliens talking with me.
Mm. Yeah, seemed like a really difficult time for you, Anne. And in all this, how has been your mood?
Oh, I felt I was terrified. I was so
Mm,
afraid. I don't want them to impregnate me.
mm, I see. How possible is this that aliens can impregnate you, Anne?
I don't know.
Mm,
I don't want them to impregnate me.
mm, okay. And in what way do you think they will impregnate you?
What do you mean? They will impregnate me. They said that they want to have alien babies from me.
Oh, okay, okay. Have you been sleeping okay, Anne?
No, I cannot sleep. They might come while I'm asleep.
I see. Seems like a really difficult time for you, Anne. Yeah. A bit of questions about the overdose. Can you tell me how that happened?
Well, what happened? What?
Okay. Yeah, I know from the notes that you took some tablets of the overdose.
Yeah, I
Yeah,
took paracetamol tablets
yeah,
because I
yeah.
don't want them to impregnate me.
Okay, all right. Yeah, that seems like a difficult one. And how are you feeling now after the overdose?
Well, I'm feeling better, but I know that they will come.
Okay. And do you feel safe right now?
No,
Mm, okay. And do you think this overdose, you think you're going to do it again?
I don't know, doctor. I don't know. What
Mm.
can I do in order to prevent this?
Yeah, that's why we are here to support you. And okay, that is why I'm asking you this question to see how best to support you. Okay. Um, and I'm wondering, okay, who lives at home with you?
I have my stepfather living with me.
Mm, okay, and who else apart from your stepfather?
There's my mother, but she's not with us.
Okay, how is your relationship with your stepfather?
It's good. It's good.
Mm, it's all good. Yeah. Yeah, it seems like a lot has been happening. I wonder how you've been coping with you having this thought of the aliens. Have you been taking alcohol?
No, no,
Any chance you've been using illicit drugs?
no, no,
No, no. Okay. Has this ever happened to you before in the past where you were hearing voices and you took
no,
like an overdose?
no,
Sorry?
no.
Okay. Okay. And do you have any physical health condition?
No, they said that I'm physically okay. No
Yes,
problem.
okay, that's good to hear. And apart from your stepfather, I'm wondering, you have any other support network around?
No one else. My mother is not around.
Okay, all right. Um, and what do you think will be happening to you right now?
I don't know. I'm worried.
Yeah, yeah. Anyone will be worried with this kind of experiences. Okay. There are a lot of things we could do to help you now that you are here. Yeah, okay. Yeah, with this, you having this thought about these aliens, have you been trying to look for them to see how you can confront them?
No, no. I'm afraid. I'm afraid.
Mm, mm, And how are you going to protect yourself to keep yourself
I
safe?
don't know. I don't know, doctor.
Mm,
I don't want to be impregnated by them.
mm, mm, mm. I see. And are you having any thoughts to further harm yourself?
No, no.
Mm, okay. All right. And with all this you've told me that you've been having thoughts that aliens are out there to impregnate you, and you really do not feel safe. Okay, you've not been sleeping fine. Okay. Um,
Time, time,
um,
time, time, time. How do
okay.
you feel about what you did?
I don't know. This is the first time I was a bit maybe before I came, I had a whole thought about what the station would be, but I really did not know that it would be a psychosis in pediatric overdose. So I think I was a bit here and there. Okay, but
It was
um,
very
uh,
organized.
yeah,
Yeah, it was not
yeah,
very organized. I felt that you can do better.
yeah,
Okay,
yeah.
okay. So I can we have just some feedback and
Mm,
let's all help each other. If you can give the dear doctor some feedback, it would be very good. Okay, nobody. So let's see, according to the mark to this pediatric overdose. So it is a station which you need to be very empathetic, and you
mm,
must understand that this is a compound or complex task.
yeah, sure.
So you want to know exactly the risk and if she is suitable for discharge.
Mm,
Very important. So you must
mm.
terminate the station by saying whether it is suitable for her to
Able for
stay.
discharge. Okay.
The seriousness of the overdose and the presence of mental illness and the circumstances leading to always should be put in your mind.
Yeah.
Okay, while you are doing this station.
Okay.
It is not that easy. I don't know. What did you expect? You said that you expected something else.
I thought, no, maybe that this psychotic parts to it, like this alien fear controlling. I thought I've not seen it.
Okay.
So, yeah.
So now, if
Mm,
you are in your hospital and
yeah.
so this is a real situation, and someone came to you by a suicidal attempt, what will be your priority?
Yeah. I want to assess the risk, like know why she
Yes,
took
so
it.
the first thing
Yeah.
you should do is to know exactly what are the circumstances of the suicidal attempt. Yes,
Yeah.
I might explore or I might express some depressive symptoms. Okay, you can dig around these symptoms and then you can go back by signposting and ask me more about these, the important part of the history, which is the suicidal attempt, which I did not feel that you paid attention to. This is a risk assessment station. Pay attention to it. So, so this is a plan, simple plan, which will help you how to do take risk, take history with risk assessment. Okay. So the first thing you want to know exactly is the incidents, and then you want to know what happened after the incidents and what happened before the incidents. And under each of these headings, there are some factual information and mental state. Factual information and mental state, and also before the incidents, there are factual information and mental state. And this is the timeline. So incidents, what happened after the incidents, what happened before the incidents, and the factual information and the mental state under each heading. There is a simple video clip about how to assess the risk, which will help you to do it in a very smooth way and professional way. Okay. And this is how you should start your station, by assessing the suicidal attempt, in order to make sure that this is a serious suicidal attempt, and accordingly you will decide at the end of the station whether it is a high risk and requires the admission or not. Okay, so your introduction was, I didn't feel that it was very empathetic. Show empathy. In this particular station, she will be holding a piece of paper. Ask her gently that you want to know exactly what is written in the piece of paper, and ask an open-ended question. So can say something like, I can read that you have written aliens. Can you tell me more about that? And let her talk about the aliens. Ask one open-ended and 2 to 3 close-ended questions, and then return back to the main sequence, which is the suicidal attempt. Okay, are you with me?
Yes, I'm with you, Doctor.
There are many ways by which you can start the station. For me, because she's a child, I would like to go very smooth and very empathetic. So I want to take some social history in the beginning. So can you tell me more about you? How about your family? Do you have siblings? What about your father? What about your mother? Do you feel that your family is supportive? Any change in the life circumstances recently? So I would like to go very smooth with this young girl. Okay. So after going, so now after just having this little chat, how about talking about the serious events which happened today? Okay. And then go through the suicidal attempt, which we have just mentioned, by the sequence which we have just mentioned, the incidents, after the incidents, and before the incidents. Okay, I will not read the notes. You can have screenshots. Okay, just have a screenshot here. One.
I've done that.
Okay, and then have a screenshot here.
Yep.
Okay, so this is how you assess the serious incidents. Okay, so after assessing it, you will discover that it was a serious suicidal attempt, and this girl definitely needs to be put in the hospital, and this is how you will terminate your station.
Yeah.
Okay. Now the symptoms of syndrome, so it is very apparent that there is psychosis. So ask her about her experience, the current situation, and the onset. When did it all start? The course, the psychosis, the depression. Don't ask about the comorbidity. No need. You already assessed everything. And then impact, coping, and risk. Very important to ask her how did all affect her life after this. Very important, her study and everything. Okay.
Okay.
Study.
Yeah. Thank you.
Okay.
Thank you.
Past history and family history. Now, this is a trick because it is in this station stated that the girl has a mother who is already admitted because of depression. So she has a mother which is admitted because she has depression and finally delivered the diagnosis. Okay, so let's see. Now the diagnosis, you can see that you are passing through a difficult time. Show empathy. It will be better for you to stay in the hospital because it will be safer for you. There are a lot of concerns about your safety. Okay.
Yeah. Thank you.
Unfortunately, your priority did not meet the conditions, because your priority is to assess the seriousness of the attempt. You did not do this. Significance of aspects of history, unfortunately, no. Yes, you did ask about the relevant symptoms in history regarding the depression and the psychosis. Okay. Risk assessment, unfortunately, you did not assess the suicidal attempt in a very good way. Health view, yes, you asked me about how do you feel about everything. I felt that you want to know my opinion. Social and psychological, I think you did you ask me, you did ask me about my social information and psychological, yes, okay. It was disorganized, not very good way of organization, did not finish at time. Everything regarding the communication, I don't have any problem with. But as you can see, there are considerable things which you need to work on in the history taking part. Okay. Your language is good, but the history taking should be better. Okay, thank you so much, doctor. So who would like to go next? Thank you so much.
Hi, I'd like to go next, please.
Okay, yes, let's see. You are Nima?
Yes.
Okay, Dr. Nima, what is your station?
Heroin in pregnancy.
Independence. Yep. Okay. Go to drink some water, come back.
Okay. Yeah, I'm ready when you.
Yeah, okay.
What's your name?
Choose a name for me. I don't have any name.
Okay. Sarah?
Sarah, okay, Sarah. 1, 2, 3, go.
Hello, Sarah. I'm Dr. Yusuf. I'm one of the psychiatrists here in the Drug and Alcohol Service. I understand you have some concerns and you would like to discuss with me. How can I help you today?
Well, I don't know, doctor. I discovered that I'm pregnant and I'm still using stuff and I don't know what to do.
Okay, I can see you're quite concerned, and I'm here to support you and answer all your questions. Sarah, when did you find out that you're pregnant?
This was about 2 weeks ago.
Right, okay. Now, how do you feel about this pregnancy?
Well, look, it is a very, very chaotic life now, and I don't know what happened. I don't even remember how it happened, doctor. So
Hmm,
I don't know what. It's totally unplanned.
okay. And do you have a partner?
Yeah, he is very happy and he wants to continue and he wants to have a baby. But I don't know, doctor. I don't know what to do.
Okay. Have you had any thoughts around keeping the baby?
Well, I'm still just this. I'm still in the state of shock. I don't know what to do.
I could imagine. I'm here to support you and I'm happy to answer all your questions. Is it all right if I ask you a few questions just to get more information about how the situation is?
Yeah. Okay.
All right. I know this might be a bit sensitive to answer these questions, but it's really important for us to get all the information so we are able to help you.
Okay.
All right. So, Sarah, at the moment, are you using any drugs?
Yeah, I'm using heroin from time to time, and I'm also using crack, but not like heroin. I'm just taking it with my partner. And I'm also taking methadone from your side.
Okay. And how much heroin are you using exactly? Do you know?
Just not like before, maybe 1 gram every week. I used to take it on daily basis, but
Mm-hmm.
now every week 1 gram.
And how long you've been taking this much?
Well, I used to take 1 gram not less than 3 years, but when I started taking methadone, it is down by 1 gram for 1 year now.
Okay. And does this increase at any moment, like in weekends
Yeah,
or?
yeah, yeah, in the parties, and when gathering with people who are taking drugs, it can be more.
Okay. And how do you take it usually?
By sniffing, sometimes by injection, but mainly by sniffing.
Right. Okay. And do you take any other drugs?
Occasionally with my partner, I take occasion, but not. So I just try to crack from now and then.
Okay. And is that consistent? Is it occasionally but consistent? Like, is it once weekly or
No,
once
no,
month?
no, no. Just there is no particular pattern. If it is not there, no problem.
Any other drugs?
No.
What about alcohol?
Well, sometimes I drink alcohol, yeah, but not a boozy, and I just don't get drunk.
Okay. And do you feel like this is increasing or is it hasn't been the same?
Well, no, it is since starting with methadone, it's just 1 gram every week. Yeah,
All right. Okay. And are you taking your methadone consistently?
yeah, yeah.
Okay. Um, I know you've been taking this for 3 years now, but is there anything that triggered you using drugs?
Yeah, and just started it occasionally in the parties, and with time, I take it more and more frequently, and then I'm stuck.
Hmm.
So I've been taking drugs for about not less than 10 years now, but continuously not less than 4 years.
Okay. Have you ever stopped completely?
No,
Okay. Have you been through a rehab center?
no, 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 no.
Okay. Do you ever experience any symptoms of withdrawal if you try to stop or reduce how much you're using?
Well, if I don't take methadone, yeah, 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 I feel horrible. Yeah, like nausea, vomiting, the body aches. Yes.
Okay, shivering,
Yeah, yeah, exactly.
diarrhea, do you get that?
Yes, yes, yes.
Okay. Do you what about your life? How's that going? How are you coping with this use?
Well, my life is totally upside down. I don't know what to do. I'm stuck, with group of friends. Most of them are drug addicts. I don't have a source of income. And there's no place for a baby now, but I'm pregnant.
Yeah, that must be really overwhelming for you. Is there anyone that's supportive at home for you?
Only my partner.
Okay. Do you have any debt with how much drug you're using?
Yes, I have a lot of debts, yeah.
Okay. Any issues with the police?
No.
Okay. What about your physical health? Do you have any medical issues?
I didn't do any medical checkup, so I don't know.
Hmm. With using drugs, especially injections, there's a risk of blood transmitted infections. Do you share
No,
need?
sometimes, yeah.
Okay, have you checked that? Been
No,
tested
I
that?
didn't do.
Right. Okay. Do you? What about your mood? How has that been impacted?
Well, mood is fine. I don't have any problem with my mood, just only my chaotic life.
Okay. Sometimes where people are using drugs, Sarah, they experience unusual things like hearing voices or seeing things that others can't see.
No.
Do you ever feel people are out there to get you or to
No,
harm?
no.
Right. Okay. And you mentioned that you've been with the drug and alcohol service. Have you been attending all the appointments regularly?
Yes, time. How do you feel about what you did?
Oh, good. I didn't know that there was 1 minute.
No. Did I say 1 minute or I didn't? I didn't say.
No.
Okay, so it was good, but you need just to control the way you are talking. You are very good in your communication, except that you use long sentence. Sometimes this interrupted way of talking. You only needed not less than maybe 5, 10 seconds maximum.
Mm.
Okay, so it was very good, actually. Very, very good, actually. I don't have any comment except that once you hear the bell, you didn't hear it, so I cannot blame you. You ask about everything. Um, Maybe you asked me about the follow-up. So you did everything except that when you delivered the only thing was missing is that personal history and family history and delivering the diagnosis. So my only comment is that
Mm.
make sure that the way you are communicating is more fluent and not interrupted. So if the way you are talking, and this is a big question mark with many candidates, they don't know exactly where they lost time. They are very organized. They said everything, but the issue is how they are saying it. With time, you will feel that we will adjust your performance in 7 minutes. It needs some time, but it can be achieved. 7 minutes is a challenging thing. No one can say anything else. So it needs practice. Okay, but very good. I don't have any comment. Everything was good. Your approach is very good, particularly when you asked me in the very first beginning about how do I feel about the pregnancy. The Middle Eastern immediately congratulate about the pregnancy, and they become faced with a very defensive patient after congratulating them. As you can see, this is a lady who's leading a very chaotic life, and now she is pregnant, suddenly unplanned pregnancy, and
Yeah.
she is not happy with the pregnancy, and the candidates insist on congratulating her, and they face a not a very good situation after that. So pay
Mm.
attention. Don't congratulate the patient except after making sure that she's happy with the pregnancy. If she's not happy, let her know that you are here to help her. Then go through the stage. Okay.
Yeah.
Okay, just for the
Thank
sake
you.
of time, thank you so much, Doctor. Very clever. You're very clever. So, but pay attention to your communication, the way you are talking, not lose time. Thank you so much.
Thank you.
Let's see the chat section. Yes, more organization. Thank you. Well, yes, Rufaida is asking, saying that how does she get money for drugs is a very good question. Usually, these types of patients they have a partner which makes sure that they get their in order to get the stuff, the girl just hang up with someone who can afford giving her drugs. So you can understand the way they are living. Okay, so who would like to go next?
I can go next, doctor.
Dr. Summers, so what is your station?
GHB dependence.
Okay.
Okay, doctor, I can go.
Okay, for those who don't know what is GHB, it is very close to alcohol, except it is very cheap. It can cause side effects more common, and it can be injected. But the
So,
effect, yes,
doctor, we can say GHB or we have to say as a street name or so.
yes, you can see GHB, no problem.
Okay.
Okay,
Name of the patient?
Michael. Let's say that my name is Michael.
Okay.
Okay, 1, 2, 3, go.
Hello, Michael. I'm Dr. Summer from the mental health unit. So we understand that you have been into the hospital early in the day because of some instance happened. Can you tell me
Yes.
more about that?
Well, I don't remember. I've been in a party and then I woke up
Mm.
in the ER. I don't
Okay, so
know.
how are you feeling now?
Not very good. I have some shakiness in my hand, but I can manage.
Hmm. So do you remember anything happened through this party?
Yeah, yeah. Well, it was a party. We had a lot of girls, and
Hmm.
I took some GHB, and after that, I just don't remember anything.
Okay, I see. So do you remember how much did you take?
I remember that I took more than what I usually used to take because it was in a party, and also I took
Hmm.
alcohol.
Okay, so do you remember what's in your mind when you take this GHB?
Just wanted to have more fun, okay, and I also, it
Hmm.
helps the boys with the girls, so I also
Hmm.
wanted to make the girl feel that it is a safe drug. So I took more than what is usual. I think this was a
But
stupid
you
thing.
Okay, but you didn't intend to harm yourself by any means?
No, no, no.
No. And after that, what happened?
I don't remember anything. I found myself in the ER.
So you don't remember what happened. Okay.
Yeah.
So about the GHB taking, I know it's a sensitive issue to ask about, but I need to ask a few questions to make sure I can help you. Is it
Okay.
okay?
Yeah, yeah, no
So,
problem.
Michael, when did you start to take this?
Yeah, I started not less than 10 years ago in the parties. It was occasional, but now I'm stuck with it.
Okay, and was there any specific situations happened at this time?
Always in the parties, it is related to the parties,
Mm,
and it makes the issues with
mm,
girls easier. So I used to take, and it's very cheap. And I was only teenager at this time,
mm.
so this was the most, best thing to buy with money.
Yeah, I see. And through all these years, have did you escalate
Yeah,
those?
with time, I feel more and more that I'm increasing the dose. Now I'm taking not less than 2 milliliter every day.
Mm,
So,
okay. And how do you take it? Time or what?
well, I sometimes
Can you hear
mainly
me? How
by
do you take it through the day? Is
well,
it by
I
injection
take
or
it
any
by
other means?
no, but I drink it. I don't injections
Mm-hmm.
only in the parties, and it is not a very good idea. It just makes me lose consciousness.
Okay. And before 10 years ago, did you take any other medications or any
No,
other drugs or
no,
alcohol?
no.
No, that's good. And do you feel, Michael, that you don't have control over your intake of GHB?
Yeah. Exactly.
Mm,
Yes.
and you have that great desire to take it every day?
Yeah, exactly.
Mm. And have you ever left any meetings or important appointments to take your dose of
Well,
GHB?
my life is totally now and on the GHB. Whenever I feel
Mm,
craving, I can't do anything.
yeah, I see. And you told me that you have escalated the dose. Do you do
Yeah.
this to have the same effect?
Yes.
Okay.
I
And
can
have you
hardly
ever
keep it two
Mhm.
milliliter. Yeah.
and have you ever tried to stop it?
Yes, I tried, but I couldn't. Horrible feelings.
Can you tell me what happened when you tried to stop it?
I feel bad things inside me. I'm not good.
I see. And Michael, do you have any other underlying medical disorder?
No,
Taking any medications?
no.
Michael, such drugs might bring some unusual experiences like hearing voices. Have you ever experienced
No,
that?
no, no, no.
And how about your mood?
Everything is well. Don't have any problem.
Mm, And your sleep?
Everything is good. Yes. Don't have any.
And have you lost any weight recently?
No.
And about your social life, what do you work? How do you get your
I cannot hold with
GHB?
any work. I left school. I used to do
Mm,
some manual works, but I cannot keep a job because of my drug problem.
I see it have affected your work. Okay. And how do you finance this?
Sometimes I do some drug dealings and so on, but I hope that you don't tell the police.
It's all in confidentiality. Don't worry, Michael.
Okay.
Uh, So you have been through any legal problems because of this?
No,
Any financial problems? You have such debts or
I
so?
have debts. Yeah, I have a lot of debts.
Mm, How about your social life, your friends, your partner,
No,
if you
no
have
friends now
one?
except the drug addicts. All my left friends left me.
Okay, and do you have anyone want to support you,
1 minute.
your
No,
partner or so? You, you hear me?
I cannot hear you.
Michael, are you there?
Yes, but I cannot hear you.
Okay, you hear me now? So Michael, I can see that has a big impacted your life in such a lot of ways. Is it okay? Is it right?
Yes.
Yeah, and I need to ask some question because I'm concerned about you. Do you share needles or syringes?
No.
Have you ever used it in chemsex or so?
Yeah,
I'm
sometimes.
sorry to ask you
Yeah,
some personal
yeah.
questions.
Yeah.
Yeah, yeah, okay. And sometimes people may have these dark
I don't hear you.
thoughts about harm
No, I don't have any thoughts of harm.
themselves. Has ever happened to
No,
you?
no,
Harming themselves. Okay,
no.
is it the first time to talk to psychiatrist?
Yes,
What? Is this the
yes.
yeah? Okay. What about your family members? Any contact with mental health service?
No.
Okay, thank you for talking to me, Michael. I think what's going on with you is what we call GHB dependence. What about talking to one of our team members to help you to stop GHB?
Okay,
How
time.
does
How
this
do you feel?
sound to you?
Feel about
I
talking?
tried to cover most of the domain, but
Very
the
good.
network was so
Very,
sorry for
yes,
this.
yes, no problem. I don't think this will be a problem in the real exam. There is no network. That's very good. But make sure that you ask about if there's any family member who also has been using recreational drugs, not only the issue of
Yeah,
having substance dependence, the use of recreational
yeah,
drugs around the families, everything is okay with your performance. I don't have anything. Only thing, make sure when I when you ask me about withdrawal symptoms, show the examiner that you know the withdrawal symptoms of the GHB. It is very close to alcohol. Okay, tremors, sweating, palpitations. But in addition to this, the patient can also get some hallucinations. Okay, agitation and
okay.
hallucinations and paranoia. So it's exactly like alcohol, but in addition to it, there can be some psychotic symptoms like hallucinations and paranoia, ideas and agitation. I think also in alcohol there is some sort of agitation. Other than this, it was very good. Your performance and your approach to the sensitive issue of taking any substance is very good. And the very good thing which you did, you know that this is a patient who came to you from the ER. He was comatose, so you want to make sure that he's okay. It was a very good introduction. Very good. I don't have any comment. Maybe our colleagues can have any feedback. I think we didn't ask about overdose symptoms. Well, I think he is already comatose. So what do you need to see? The man already is overdosed. So I don't know exactly what do you mean, Dr. Mariam. Okay, so thank you so much, Dr. Summer. Just for the sake of time, I will not go through the worksheet again. Who would like to go next? Okay, have we finished? Okay. Okay, I hope that you found it helpful. Please read the stations again. Try to practice it. If you don't find a study partner, I really recommend having ChatGPT as a study partner. Yes, ChatGPT. Give him the scenario, give him the conditions of the exams. One, say 6 minutes, then the bell after 6 minutes. The whole station should be in 7 minutes, but everything regarding the task, the ChatGPT will do it in a very good way. Maybe it will be only a voice, but all in all, it would be better than not having a study partner. Okay, and make sure that you use the mark sheet as your reference to assess yourself. Thank you so much, dear doctors. I hope to find the names in the whole in the pass list. Thank you so much. Have a good night.